I've been asked if there are any special cases or interesting cases, and I have to say I've seen hundreds, thousands of patients with tinnitus. Several things stand out. One, the patient comes in and they say they've noticed in the last week or so that their ear is ringing, and I'll look in their ear and find that it's all packed with wax. Well, that's great. Take out the wax, and because I've corrected their hearing issue, the tinnitus goes away. Now, I wish they were all that way. The other thing we found early on, and how I got into this, was with patients who have a profound hearing loss, cannot benefit from hearing aids, and we've been doing cochlear implants since the early 1970s. And one of the early findings was that the patients who were using their cochlear implants to hear found that their tinnitus was resolved in more than 50% of the cases. So that kind of stands out as one of the things which got me kind of interested in tinnitus, trying to see if I could electrically stimulate the ear. Unfortunately, it didn't help because the tinnitus was probably helped by just improving their hearing. One question is brought up is, how do I diagnose tinnitus, or how do I evaluate a patient with tinnitus? First of all, tinnitus is not a disease. Tinnitus is a symptom. So obviously the first thing we do is take a history. When did it start? What factors are there? When does it bother you? Is there anything that makes it better? And then we have to do an evaluation. A hearing test is very important because tinnitus is often associated with a hearing loss. Now, depending upon what we find in the hearing on the hearing test and on my examination, we can gear a treatment for whatever the underlying cause is, if possible. As I said, many times it can be due just to a hearing loss, and by using hearing aids to correct the hearing loss. Or if it's a type of hearing loss that can be corrected with surgery, this many times will help the tinnitus. What about a patient who comes to see me who has, let's say, tried all kinds of things? They've been to several doctors, they've been putting on various vitamins, ear drops, antibiotics, you name it, and still they're very disturbed by their tinnitus. And as I mentioned, or have I talked about using electrical stimulation, when I was doing that study after finishing my fellowship, I found that so many of these patients with severe tinnitus are very stressed, and that stress was such an important factor. We did some psychological testing and found that stress and depression were important components. And that's what led me over to doing something called biofeedback training. Now, biofeedback is a method of trying to teach patients, for example, to relax the muscles, to dilate the blood vessels, even to monitor their brain waves, to put them from a stressed anxiety state into a more relaxed state. As soon as they do that, typically the tinnitus will decrease. And in our study, about 80% of the patients did have good results with biofeedback. And biofeedback is a sessions, I don't call them treatments, but they are, we were using 1-hour sessions once a week for 12 weeks and had pretty good results with it, but not for everybody. So unfortunately, there's not one sure cure for tinnitus. So that's why we have to evaluate it. We have to determine the best approach for that particular patient.
Hello, my name is Dr. Kevin Peng, neurologist here at the House Institute. Thank you for watching this video. The House Institute provides free educational videos for hearing health professionals worldwide. To help support videos like these and other educational efforts, please consider donating by clicking the link in the description box below. Your generous support allows us to keep videos like these at no cost for you and others. Thank you.